Hi, everyone. Welcome to Doc Dynasty. This is Dr. Po Raval, navigating the current healthcare scenario and keeping physicians independent. So we're going to talk about three things that all physicians should be concerned about when they are offered a private equity deal. This is coming from JD Supra, written by attorneys who are dealing with these buyouts of physician practices. So number one, the tax treatment of your practice when it sells. So when a private equity company buys out your practice, they roll over the equity in their practice tax-free to their corporation. On the other hand, your sale of your practice will be considered a capital gains tax, which means you're paying right now approximately 20% on the sale of your practice. So it's going to cost you. You may be making money, but you're going to be paying out 20% at least in capital gains. Therefore, very important, always have a bank person with you, meaning it could be your local bank, it could be a wealth manager. Have them look at the structure according to banking guidelines, and always have your CPA there. Number two, execution and the risk of these deals. So when you sign off on a contract with most of these private equity companies, there's a whole bunch of things that you will sign off on that you didn't expect, meaning there are waivers and consents. These waivers and consents are there to help the private equity company. They're not there to help you. So they should be evaluated again by your attorneys, but also you have to know that if you do not sign off on these, then the deal may not go through. And you need to have them read very carefully because they are not there to protect you. They're there to make it a favorable deal for the private equity company. So be very careful of what risks you do have by signing these waivers and consents. Number three, there is a new insurance called the representation and warranty insurance. It's largely taken by private equity companies because it limits, again, their risk. So it indemnifies them for exposure, breaches, misrepresentations, warranties that weren't covered. They are covered, you are not. So either you take this insurance or you speak to an attorney that helps to indemnify you. So what specifically are physicians at risk of this deal not going through, but also legal risk? One of the biggest things is a violation of Stark laws. So if you remember, these Stark laws were designed so that if physicians had a part financial stake in other companies like blood labs or other items that they refer out, if that physician has an equity stake in those companies and you are constantly referring people to those companies and you don't divulge that you have a financial stake, you are in violation of the Stark law. So this can also apply to the sale of your practice. If you are invested in other companies or you cut a deal with a private equity that's where they refer patients to, you need to have these things looked at by an attorney so that you are not in violation. There are other violations as well. Right now, this seems to be the biggest violation that's going on in these private equity deals. So these are the three things that you should be most concerned with when you are working with private equity companies to sell your practice: tax treatment, deal risk, and limiting your exposure are three big things. Always have, bare minimum, your attorney, your CPA, and a bank official looking at the contracts. You cannot spend enough to make sure that you are safe. I hope that this helps very much. Of course, subscribe, comment. We want to hear from you.